Hello, everyone out there in radio land. Y'all. All right. So now I think I'm going to transition to some more local stories, and this is all kind of under the umbrella of COVID-19. And basically, it starts. I'm going to talk about kind of the state of Michigan in macrocosm, and then drill down into some things that have been going on locally. But I think the most important story to start with is this statewide story, and this is just running some numbers. Um, and I think it's a really important reminder. I think to many of the people who listen to my show, I'm kind of preaching to the choir. But at the same time, you might be a college student just tuning in, or just somebody. That's one of the reasons I like doing this as a radio show rather than just a podcast, because people might just tune in and randomly start hearing. So anyway, we are not out of the woods by any stretch of the imagination. And honestly, the kind of like wishful thinking, getting ahead of ourselves, could end up having some very deadly consequences. And to really just put a fine point on it, I want to point out the Michigan COVID-19 caseload is up 56% since the beginning of March. And that's when we started getting cocky. That's when we started thinking like, the end of this quarantine and COVID-19 is on the horizon. As this article states, this is from WWMT. It's published as of March 16th. Michigan reported 2,048 cases of COVID-19 and 27 deaths on March 16th, 2021. The fourth time in 7 days, the state reported at least 2,000 cases in a single day. Data from the Michigan Department of Health and Human Services shows the state's average number of cases per day is 1,951, an increase of 140% since February 20th, when the state averaged 814 cases per day. In just the last week, the average number of cases in Michigan jumped 56%. As the state relaxed restrictions and the number of children in classrooms around the state has increased, Calhoun County Health Officer Eric Pessel said increased spread was an obvious risk. Going on, talks about as cases increase, caseloads in Michigan headed in a different direction than those in Midwestern neighbors like Illinois, Indiana, Ohio, and Wisconsin. It's not necessarily that another state is doing things differently that are better or worse. It just may be that we've seen outbreaks in states and then they subside. As of Tuesday, 24.9% of Michiganders have received at least one dose of the COVID-19 vaccine, and 14% are fully vaccinated. So I guess my big, the thing I really want to implore the most is like, even those of us who've been really careful since the start of this, like we all slip a little bit, and especially like it's been a year. It's been a year. A lot of us are like, we're desperate for social interaction, or maybe we're just letting our guards down, but we absolutely cannot do that. We're so close to the end of the tunnel on this, folks. And like, this virus still has enough time to wreak some beta havoc and have, another surge before there's enough people vaccinated for herd immunity. So we really need to still be careful, still do our social distancing, still stay inside as much as we can. And you know what? Spring is coming. We can start like social distancing from one another and go outside. And again, one of the good things, and I will give some credit to the Biden administration for this, is we're starting to see an acceleration of people vaccinated. And it sounds like by the beginning of April, we're going to be able to start just vaccinating everybody. So the light is at the end of the tunnel, but we're still driving, and it's still a very hazardous tunnel. So please be careful. Please, I'm begging you, be careful. And especially all your relatives, your friends and family who maybe they're just tired ripping the masks off and all that. I'll just urge them, maybe one last time, please just stick this out, stick this through. Although that's easier said than done for some other. But I was debating like friend of mine. I'm not gonna call their name, but a colleague of mine. I was kind of debating. They got this whole line about like, well, masks, they're making you wear the masks so that you act like a sheep, and if you're acting like a sheep, you're with the and like I don't know, people like that maybe a little too far gone. I don't know. That's maybe like that's a whole separate topic, and I could spend some time talking about it, but let let me just put a pin on that. There's a big difference between resisting the government and their evil, like in a very valid way against the evil they're doing, and just abdicating common sense because you just want to be like, I'm not gonna do what you tell me. Oh, oh, this germs don't care whether you oppose the government or not. Yeah, that's a big thing. All right. So moving on from that, I wanted to also point out this is something we didn't. So I was out on vacation when this was really breaking. We didn't really have time to. I didn't end up talking about it too much, but several weeks ago, there is a big a fit, I guess you'd call it, bit of public pressure. The Kalamazoo Public School District is one of the few districts that is sticking to virtual learning all year round. Now, at first I didn't really want to touch it too much because, like, full disclosure, I don't have any kids, and I can't even begin to imagine the challenges a lot of my listeners with children have had over this past year. I think it would be a little insensitive of me to just be like, like, oh, like, well, you just want to throw your kids in the volcano, blah, blah, blah. Like, no. Like, I understand that the challenges that come with it, particularly, like, I've heard some like heartbreaking stuff from people who have, children with special needs, children on the autism spectrum, stuff like that. Kids are very challenged, like, kids with extra challenges that make it more difficult to do the virtual learning type stuff. And, it should be noted that, like, the frustration from these families, it's valid. We got to understand it, and they need support. However, there's a lot of caring, and in particular, there was a lot of really gross stuff coming through the pipeline, kind of racist, misogynistic, and violent messages coming in to particularly like Rita Ronachari, who's the superintendent. It's something that was commented on by a couple of other of the school board members, such as Megan Maddock and Tandy Moore. Tandy Moore actually ended up getting a whole bunch of flack from some of the more reactionary parents. They're trying to like get a pro resignate, like trying to resign her off the board for essentially calling out what was going on for what it was, which was basically trying to harass the school board into reversing their decision. Which at the end of the day, and I will say this much, on the show, we've heavily criticized the Biden administration. We've criticized Gretchen Whitmer for trying to get kids back into school as like an objective unto itself. And like, we get it. Parents need a break, but the virus is still out there. You should not reopen schools until COVID-19 is under control. And I'm sorry, not sorry, but that has to be the reality of this thing. Like, we have to protect, students, teachers, faculty. And I understand there's a lot of hardships that come along with that. And I think that, there obviously should be help for, people low income, people who do not have the same resources, it's kind of upwardly mobile folks. But that does not mean that we should just reopen schools and expose people to a deadly pandemic. It's also worth noting that, some of these people who were against the school board were also trying to kind of prop up, low-income students of color as like, oh, well, look what you're doing to them. And I think it's worth noting that, like, when you look at the actual public support of most of those low-income folks, it is for the school board. And a lot like Tandy Moore in particular. I remember a lot of the organizations that have mobilized around her in the past in previous elections are these progressive organizations that focus on things like the school to prison pipeline, racial disparities, et cetera. So, that's a false argument. Not to mention, and I think it's worth giving KPS a lot of credit for this. We've seen some of the lowest infection and death rates of people of color students in the states, and a lot of that has to do with the way the Kalamazoo Public School Administration has tackled the pandemic. So I prefaced all of this to bring up, well, what happens when you don't do that? Well, here's a story that dropped about a week ago, and here's what happens when you don't do what Kalamazoo Public Schools just did. And this is a perfect example because Portage is right next door. 44 Portage district students and staff test positive for COVID-19. The Michigan Department of Health and Human Services reported Portage Public Schools had the largest COVID-19 outbreak at schools and universities in Michigan. According to state data, 226 students and staff across Michigan have been infected in new school-related outbreaks. State officials labeled an outbreak as two or more cases linked by place and time, indicating a shared exposure outside of the household. So I really just want to drill down and show you that comparison. Portage Public Schools, which is like a 20-minute, 10, 15-minute drive down the road, is on the same bus line as Kalamazoo Public Schools, has a very different policy, more open, more about getting kids back into school, and they are the foremost vector of infection in the state. Again, our next door neighbors. It's like you were in Portage when you go to Meijer to get your groceries, et cetera, et cetera, et cetera. Difference between one of the lowest infection rates and the highest infection rates. And it's all about the decisions made and the culture around how do we approach teaching students during this pandemic. Now, I'm going to cap this off with one last COVID-19 related story. And this is actually, it's kind of a weird confluence. We just talked about people being Karens. We just talked about racial disparities. So what happens when all this kind of toxic stuff meets together? And this is a kind of a sad story, but it's a good story because I want to highlight the good work of Mothers of Hope. Mothers of Hope started a pilot program that's going into low-income, racially diverse neighborhoods in the Kalamazoo area and trying to make sure those folks get vaccines. Because if you've been following this pandemic and the news about it, especially every reporting on the show, you know that there are huge racial disparities between not only who's getting COVID, but also who's getting vaccinated. Vast majority of people who have been vaccinated thus far are white, and there's a dearth of information and outreach trying to make sure that low-income people of color have access to the vaccine. Groups like Mothers of Hope are on the ground here in Kalamazoo trying to change that, kind of make the tide break in another direction. But they also encountered a unique problem. This is from Channel 3. I'm going to read a little bit from it and then discuss. Mothers of Hope says people lied about their race to get the COVID-19 vaccine. A Kalamazoo group behind a recent clinic said some people wanted the COVID-19 vaccine so bad they lied about their race to get in. Stephanie Moore with Mothers of Hope said some people took advantage of a clinic to jump the line for vaccines from a system in place to help underserved communities, which are mostly communities of color. The nonprofit organization Mothers of Hope set up a trial run for a new state system with a plan to vaccinate Black and Hispanic residents in specific zip codes. Moore said that once the word got out, their phone lines were bombarded. They were demanding that they actually receive the vaccine, even over getting it from the most vulnerable people in our community. And that experience was not only overwhelming, but it was heartbreaking as well, said Moore. She said people didn't stop calling, even if they didn't qualify. The calls prevented others from registering appointments, and in some cases, repeat callers signed up for shots by changing their race. change their race to either Asian American or biracial, but we could still see the names and their addresses, said Moore. Mothers of Hope was forced to go underground to make sure the right people got vaccines. Doing one-on-one contact, a lot of it was knocking on doors. A lot of it was going to the large families that we know in the community and saying, can you spread the word of this to the other people in the neighborhood? The individuals need to have access to the vaccine so we can stabilize all of Kalamazoo, said Moore. She said Mothers of Hope vaccinated more than 1,100 people at a weekend clinic, but it proved how hard equitability can be. When the numbers show the haves and the have-nots, I think it's stories like this to help us better understand why that is, said Moore. Mothers of Hope plan to host another vaccine clinic in the east side neighborhood of Kalamazoo. Details are being worked out to give that community the best chance of actually getting the vaccine. So, quick to point out, here in the Kalamazoo area, it's a weird confluence because it's like you have these, I'm gonna guess, and I don't have data backing this, but it's a kind of a pathological thing. It's probably the same people that are trying to push kids back into school are also trying to game the system the Mothers of Hope are trying to coordinate to get vaccines in the hands of vulnerable people. And it's really sad and unfortunate, and it really does show that there is a huge pathology of selfishness. Not just in the United States as a whole, but even here in our own backyard. There's a lot of people who they're more concerned about their personal safety than trying to help the most affecting their community. I'll admit I got vaccinated early because I'm a healthcare worker, so I'm fortunate in that sense. But at the same time, a lot of these people who are in lower income neighborhoods, they work at jobs that you cannot work from home. When you are the working class, that means you have to go out and work. You're working manufacturing. You're making sandwiches at a food shop or a fast food place. You're washing dishes. You can't Zoom call that from home. A lot of these same people who are more upwardly mobile and are trying to game the system and all that, they are from kind of a more middle class background where they are capable of that. And I don't want to dismiss it all. There may have been kind of poor, white folks who are trying to game this. But at the same time, a lot of those folks, again, the way the vaccines are being distributed, if you are in an essential sector, you are getting earlier access than others. So it seems to me logically it would say that a lot of these people, a substantial amount, who are trying to game this vaccine program, are in a population that does not imminently need it, but they want it. There's an entitlement to it, and that's the big problem. We talk a lot about cultural hegemony or manufacturing consent on the show. These concepts that have been written about from people like Noam Chomsky, Gramsci, etc. And this is the way it kind of bleeds into our culture. And it's let me get mine. I don't care about my neighbor. I want to do for myself. And that's every single issue we deal with. We got to tackle that pathology, that psychology head on, because we need solidarity, not selfishness, if we are going to have a future. Okay, so I'm going to take a quick break. Y'all are listening to the Hood Rat Strategist radio program only on 89.1 WIDR or online at widerfm.org. Also encourage you, please subscribe to our YouTube channel. We chop up our full-length episode into quick, smaller, digestible bits around specific topics. You can, if you see something you like, you can send it off to a friend, have them watch real quick. Anyway, keep your dialogue. We got a lot more on the show. This is Hood Rat Strategist radio program, your only source for political revolution.